it's loaded with muscle. What kind of muscle would be found in the tongue? What would make the most sense? Is it voluntary?
Yeah.
Yeah. I mean, some people talk like it's involuntary. You know who I'm talking about? Hey. All right. But it is skeletal. It is voluntary. There goes Jerome on cue. Okay. Now, with the tongue, then you're seeing these little threads. So these little threads here, no taste buds. So what are they? What? Which papilla? Villiform. Yeah. So if you see thread-like structures, villiform, papilla. What type of mucous membrane is? I just told you the fun answer. What type of membrane is this? It's a mucous membrane. Nice. Too bad I didn't do that for my lab practicals.
I mean, if you did, it's cool.
Yeah.
No complaints.
Typos.
All right, and then here's the other thing. What tissue type does it look like when it's multi-layered and the cells are flat? Stratified squamous, right? These are all flat cells at the top. Flat cells. So, anybody remember the tissue type? Does it have keratin or are all the cells alive to the tip? They're alive. So what would that be called? Keratinized or non-keratinized?
Non-keratinized.
You betcha. Where else did we see non-keratinized stratified squamous in this unit?
Oh, that's in the cornea.
Corneal epithelium. Yes. All right. So that's the filiform. The only other things I want you to identify in this are the mushroom-shaped ones. There they are. The mushrooms. Okay.
Where?
The mushrooms. They're going to look like these little tops, like so.
They look like straight teeth.
All right. There's little loops inside of them. It's just connective tissue loops. They're also made up of this non-keratinized stratified squamous. So what's the name for this kind of papilla again? Fungiform. Okay, it's also non-keratinized. All right, so here's the thing though. Do fungiform papillae, do they have taste buds?
Yes.
Yes. Okay. So one thing is that there's these little valleys in between. That's called a gustatory pit. Because what does gustation mean? Taste. And what falls into that pit? Food, but also cooties, right? Brush your tongue. Now, lining the gustatory pit are these little spherical clusters. Those spherical clusters, those are the buds. So these buds are key because they are taste buds. Okay, there's cells in them. And there's like separated cells here. And if you have like good imaginoscopes, you sometimes see a little fuzzy edge. A little creepy. All right. So those are the taste buds.
Are we able to see them on the slide?
Which ones?
On this
No,
one?
which thing? Oh, the taste buds?
The taste buds,
Yeah,
yeah.
let me show you in a sec.
Okay.
So that's a taste bud. These things right here are sometimes called these little hairs. These are not hair cells though. What organelle would increase the surface area so that you can taste more stuff? Like that folded membrane. For more surface area. Start the finals next week. So.
Do you have a final?
Microvilli.
Oh.
The hairs are really the microvilli. Okay. All right. By the way, I will post a review soon.
It's gonna be on Monday night.
Actually, I've already made it, so it'll be up soon. All right. So, you guys agree this is one fungiform papilla? The space in between? Gustatory pit. All right, let's zoom in. See if we can see a bud. Look at that non-keratinized tissue. Is it flat at the top?
Yes.
You betcha. All right. You guys see these little spheres here? That's a taste bud. Okay. Imaginoscopes one more time. Oh yeah. That's a good one. Right there. There's another one. And you know, again, you have to use crazy imaginoscopes. So this is like a fuzzy tip right there. That would be the hairs. Look at this. This is nice too. You can tag it on this guy. You guys see the taste bud?
That's a taste bud.
Yeah, so right there. I'm on the chart right now.
Oh. I was like,
And here is like the valley papilla back here. You guys see the little structures on the side? Those are the buds. I wish they didn't do this off the top because they're really on the sides of the fungiform. You guys see the pit right here?
Yeah.
So this would be the taste bud right there. And those would be the microvilli, yes?
Yeah.
What cranial nerve could this be for a taste bud?
CN7 and CN.
7, 9, or even 10. Yeah? All right. All right. Is that layer there?
Pigmented epithelium.
Yeah. Yeah. Pigment epithelium. What cells are those?
Photoreceptors.
Photoreceptors.
Or rods and cones.
Yeah, which are the rods and cones, right? Bipolar cells. And then, what are these cells at the very end?
Ganglion.
Ganglion cells, right? Which really becomes what, CN?
2.
Good. We go over here. This organ is the cornea. This is really kind of dark.
Mm-hmm.
The corneal stroma, which is a dense, irregular connective tissue. What about on the inside? Corneal endo. Yeah.
Okay, I guess that was right.
What tissue type was the corneal epithelium?
Stratified squamous.
Non-keratinized graft.
Yeah.
I remember the acronym just.
And then the corneal endo was like a
Squamous.
simple squamous ET. All right, let's creep. what is this right here? What's the structure in the field of view overall?
Cochlea.
Cochlea.
Oh boy.
Oh boy. What's that?
Vestibular membrane.
Vestibular membrane. So what would be this space right there? Vestibular duct. Middle compartment? Scala media, or the what? Which duct is that?
Cochlear.
Cochlear duct.
Mm-hmm.
And then what's the bottom compartment?
Scala.
Scala
Tympania.
tympani, or the tympanic duct. Good. Sometimes you'll see some nuclei here. What's that cluster of nuclei? Spiral ganglion, right? Okay. Spiral ganglion. Scooch over here. This thing should really be more.
Oh.
Wait, no.
Do you have
There we
to-
go. Right there.
Your rods.
Is that better?
My rods great.
I think you have a light on the.
do you-
I'd say both. On the thing?
Yeah, you should have a light on the.
Oh, on this thing?
Yeah.
That would be genius.
Is it not?
Hold on, let me see if I.
Oh my god, what is that?
Oh,
Brightness. To be.
Flip down, right? What is that structure that usually should be flipped down?
tympanic and tectorial membrane.
Tectorial membrane? That was the vestibular membrane up here, right?
Mm-hmm.
And then what cells were found over here? Hair cells? Stereocilia. What would be the membrane down below? Basilar membrane? What's the collective structure called? What's this entire sensory receptor called?
Organ of Corti.
Organ of Corti, also called the spiral
Corti.
organ. Either or. Yep.
Spiral Corti.
Spiral Corti. That's not a good one. Okay. There's this, but really I blew this thing up under the microscope. You see,
Oh Lord.
this is really small on yours. Everybody know what that is right here with the rocks on top?
Otoliths.
Macula. What are the rocks on the top called?
Otoliths.
Otoliths. Are there hair cells again?
Yeah.
Yes.
Yes. Alright. I'm scooching. What's the macula for, by the way? What would be the function?
Acceleration, deceleration.
Static equilibrium, so head position, as well as linear accel decel, right? Okay, which is a linear dynamic. Okay. What? All right, what about this guy?
Cupid's.
Cristampularis. There's a little gel on the top. What's that?
Cupula.
Cupula. Are there hair cells again?
Yes.
Yes. All right. What's the function of the cristampularis?
Acceleration, deceleration.
Rotational, right? Rotational acceleration, deceleration. That's pretty much it. Okay, then there was the tongue. Can't forget the tongue. We just did this, so spaces in between.
Gustatory pit.
Gustatory pit. Tissue type again.
Non-keratinized stratified squamous.
Yep. What's one bump called?
Papilla.
Which papilla is this? This filiform or fungiform?
Fungi.
Fungi. And then lastly, what are these sensory structures lining the pit? Taste buds. All right, good. Histo's not too bad, right, on this unit? Everything looks pretty different.
Yeah.
Remember that first unit, all those different epithelial tissues and connective tissues? Woo!
So with age, those hairs on the taste buds die? Or
And probably loss of taste buds.
Yeah.
So on the chart, laser dye.
Oh no.
Oh no.
We can't do it.
Get your pointer.
We're good.
Do-
Pointer stick.
Yeah, there's it.
I'm not pointless. All right,
Forms anxiety.
things that are dark, the black fibers. What part of the nervous system would that be? Parasympathetic, right? What's the origin of parasympathetic?
Cranial.
Cranial,
Sacral.
sacral. All the red fibers would be what?
Sympathetic.
Sympathetic. Sympathetic, right? What's the origin of sympathetic?
Thoracolumbar.
Thoracolumbar. All right. So here are the red fibers, so it's focusing on sympathetic more, yes? Now, you look at the horns. Where do the autonomic neurons begin? Dorsal, ventral, lateral? Lateral, right? You have your lateral gray horns. They're going to come out. They're going to go through this. What's that?
Ventral root.
Ventral roots. From the ventral root, you want to take the white highway or the gray highway?
White highway.
The what?
White
White.
ramus.
Because that's preganglionic or postganglionic.
Preganglionic.
Preganglionic, and the preganglionic is a B fiber or a C fiber?
Fiber.
It's a B fiber, right?
Yeah.
The B fiber is myelinated moderately. So that's going to be the pre. This is all pre. Still pre. But this is where the synapse can happen with the post, yes?
Yes.
What are these white structures?
Chain ganglion.
Remember the chain gang, right? So these are the sympathetic chain ganglia, okay? This whole thing is sometimes called the sympathetic trunk. So, but these are the ganglia. The synapse can happen. At that synapse, what neurotransmitter would be released normally?
Acetylcholine.
Always?
No.
Always. Okay?
Right.
So between the pre and the post is always ACH, right?
Oh, yeah.
And what does it bind to? What receptor would be found on the post ganglion neuron? N as in Nancy or M as in Mary?
And it's Nancy.
N as in Nancy, yep. Nicotinic cholinergic receptors would be found there on the bodies of the postganglionic neuron. You get a synapse. And then the postgang, does that go through the white or the gray?
The gray.
Gray, because what type of fiber is it?
C fiber.
C fibers. C. And then from there, you're mostly going to take the ventral ramus because most of your organs are in the front of your body, right? The involuntary ones. It'll go to that organ, and what neurotransmitter most of the time is released by that postganglionic sympathetic neuron?
ACH.
Mostly
AR.
norepi. Yep, mostly norepi. And that norepi will bind to what kind of receptor?
AR.
One of your adrenergic receptors, right? And that includes what? Alpha 1, alpha 2, beta 1, beta 2. If any of those receptors are bound, you're going to promote sympathetic activity or parasympathetic activity? Sympathetic activity, right? Those are your fight or flight receptors, yes? Okay. What can also bind to those adrenergic receptors besides the norepi coming from your postganglionic sympathetic neuron? Epinephrine can bind to it. Where does the epinephrine come from? Yeah, so here's your kidney. On top of that, it has a little hat. In the middle of the hat, there's the adrenal medulla. The adrenal medulla releases what? Mostly epinephrine and a little bit of norepinephrine. Yes? Okay, so here's that sympathetic chain, ganglia. All right. Now, that sympathetic chain, the top three, I want you to know. What's the very top one?
Superior cervical.
Superior cervical
Ganglion.
ganglion. What part of your body will that go to? The neurons from there?
Your pupil.
Just in general, your head, right?
Yeah.
Things in your head. What kind of effects would it do? Like, for example, what would it do to the pupil? Dilation. What would happen to your crying, your tears?
Lower your
Decrease.
Decrease lacrimation. What about salivation?
Decrease.
Yeah, because remember, you're trying to conserve fluids, right? You don't want to be crying a bunch when the T-Rex is chasing you. Nor do you want to be salivating. You're going to feel like you want to cry, right? That's true. You don't want to because you're going to be tough, all right? Because why do you want to conserve fluid? Where's all that fluid going to go to? You're going to be sweating.
Yeah.
And if the T-Rex gets you, you may be bleeding, right? So, blood loss, that's fluid. Okay. Now, sometimes you could damage this structure. Damage to that superior cervical ganglion would be called what?
Horner syndrome.
That's called Horner syndrome. What's our mnemonic? PAM. What does the stand for? Ptosis, which is the? Hydroop. What's A stand for? Anhydrosis, which means decrease in sweat production. But what is M? Meiosis. What is meiosis? Pupillary constriction, because it's loss of sympathetic. Sympathetic would normally cause dilation. Loss of sympathetic would cause constriction. Yes? Okay, good. There's that. And then we skipped over to these two. This would be the middle and the inferior what? Cervical ganglia. What are their effects when they're stimulated?
Increased heart rate and stroke
Increased
volume.
heart rate, increased stroke volume. You got it. Okay? So basically increase the activity of the heart, yes? Okay. We skipped a bunch of these. We're not naming these individually. You're welcome. Okay. But then we go in front of the spinal cord. In front of, remember, was pre. What were these clusters of white collectively? Pre-vertebral ganglia. All right. You got two, one that's up, and one that's. All right, let's just name them. All right, what is the one at the very top called? Celiac ganglion. Give me an effect that does. inhibits the stomach,
as well as
inhibits like the gallbladder. So it decreases your SLUD, right, and the abdominal, upper abdominal stuff. And then what would be the next thing there?
superior mesenteric,
Superior mesenteric ganglion. What would be this?
inferior mesenteric,
Inferior mesenteric ganglion. The superior mesenteric ganglion, what would be its major effect?
inhibits this upper GI tract,
Inhibits GI tract, inhibits GI motility, one of those things. What about this one?
inhibits the lower GI tract.
Inhibits lower GI tract or inhibits lower GI motility. Yep. So those are the main sympathetic structures that you're need to be familiar with. Yeah. Okay, let's go to the black now. What are the cranial nerves that have a parasympathetic effect?
3, 7,
7,
9,
9,
10,
10. Let's go in order then. This would be CN
3,
3. You have a pre and a post. I'm sorry, pre and a post ganglionic neuron. Yeah. Notice how the longer one is the pre, the shorter one's the post. Whereas for sympathetic, it was the other way around, right? Because the sympathetic chain was right next to the spinal cord, so the pre-neuron's going to be longer. Yeah? That CN3 will synapse here. What is this little white blob trying to represent? Ciliary ganglion. What effect will that have when that's activated? Just anything along here? The pupillary constriction. Yes, that's normal, right? What is the overall effect of the parasympathetic? What's our mnemonic?
Slud.
Or
Rest and
Rest
digest.
and digest.
Or rest and digest. Yeah. All right, so ciliary, that will cause pupillary constriction. And then there's 2 branches of 7, right? This part of 7 is going through what? What's that structure? Pterygopalatine, because it makes you want to what? Cry. Tears. So that's going to be the lacrimal gland, even though it's in the wrong location. It should be on the upper palpebra, but increased lacrimation. Look, it's also going to the nasal mucosa. What's going to happen to the nasal mucosa? Increased mucus production, right? When you cry, are you like producing mucus and you're like all flowy? Yeah, very flowy. 3, 7. What's the next one?
9,
9. What does 9 go through? Otic ganglion. That'll stimulate what?
Salivation,
Salivation. Here's another branch of 7,
the lower branch.
and that one's going through what? Submandibular ganglia. What's the effect on that? Salivation. Okay. Work our way down. That's the cranial part. What's the other part of parasymp?
sacral,
Sacral. S2, S3, S4. Keeps your pelvis off the floor, right? Because this is down in your lower pelvis area. What were the effects of your, what were these nerves called? Anybody remember? Pelvic? Splanchnic. All right. Pelvic splanchnic nerves.
pee-poo point,
What's their major function? PP? Poo-poo?
point,
Point? Yeah, why not?
Double
Okay.
tap.
Will I accept on the exam?
Yes.
Sure, why not? Your last lab test.
Hey.
Yay! By the way, just for fun, what was this nerve right here?
I forgot about that.
medial nerve,
Median nerve. Yeah, I'm not going to ask about that. Okay. Just curious. There is no comprehensive lab exam. Hooray. Okay, let's go here.
Me too.
Ready? Let's do this. All right. What is this structure here?
Lacrimal.
What stimulates this? And what would be the specific nerve? We just did it. CN 7. Okay. Right? CN 7. What's the hole? Pupil. What's the muscle structure here? Iris. What would cause pupillary dilation? Simp or parasimp? Dilation? Simp. Receptors.
Oh, man. 2.
Beta 2.
Oh.
2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. 2. What about pupillary constriction? Semperperisome? Perisome? Receptors? All perisome is MCR. Yeah, except sweat glands. Sweat glands, that's the MCR one. Okay, you didn't like that, so review that for sure. Okay. The white part of the eye, what layer is that? Sclera. What about this corner here?
Lateral commissure.
Lateral commissure or canthus versus the commissure or canthus. What's the meatball? Caruncle. Yeah, caruncle. Lubricates the eye, right? Let's follow the ear. I'm sorry, the tear pathway. Lacrimal gland. There's some lacrimal ducts here. Washes over your eye. And then what picks it up? Lacrimal puncta. And then keep going. Lacrimal canal. Then there's this little bag. What's that little bag? Lacrimal sac. And then when you cry, your nose runs. Nasolacrimal duct. Yes? Okay, good. Oh, what's that stump right there? CN2? What the heck are these? What are those muscles called? Call them extrinsic muscles of the eye or extraocular. Okay. What CN stimulate them? Let's go for it. Now you say something.
Ocular.
3, 4, 6. 3, 4, 6. Okay. Number 6 was abducens. Cranial nerves, they're back. Alright. Oh, what's the gland associated with these? Ciliary glands. What do the ciliary glands do? Lubricate your eyelashes. Okay. Why are all the models blue colored irises? I'm so disturbed by that. Racist. Okay. Alright, now. Over here. What's just this general structure here called? The superior palpebral. Okay. Inferior palpebral. There's this little baggie here. What's this little compartment? Palpebral sac, right? Is that what it was? Yeah, okay, I forgot. Okay. Palpebral sac. We'll do the conjunctiva. This one's better. What would be? What?
That's right.
It's conjunctival sac, right? Yeah. Thank you. Minus 5 points. Okay. Alright. What would be this specific layer?
Vitreous.
Retina.
What?
And the retina
Oh.
ends right here, right? What's that called? Ora serrata. Okay. CN2. On the other end of CN2 is what? Optic disc. This is where the CN2 exits, yes? What are these things exploding from CN2?
Blood vessels.
Blood vessels, right? A lot of arteries. What's the ring?
Fovea cap.
Macula,
Oh.
ossia, and in the middle?
Shoot.
Right in the middle would be what? Fovea centralis.
Oh,
What do you know about the
okay.
fovea centralis in terms of the function?
Blind spot.
Yeah, that's going to be what? Sharpest vision, right?
Oh,
Iceland cone, sharpest vision, yes?
No.
Okay. All right. When you look at something, this is you from the top. Okay.
Hot.
The left side of your field of view goes to where?
The right.
Goes to the right. Right side of the field of view goes to the. Let's follow the pathway of the light rays, shall we? Stuff will hit your eyeball on the retina. What would be the first cell that's affected?
Photoreceptor.
Photoreceptors.
Mhm.
After that, bipolar cells. After that,
Ganglion.
love it. After the ganglion cells would be CN2. And then there's a crossing.
Optic
Optic
chiasma.
chiasma. After that, Optic tract. There's some synapses going on right here. A synapse, thalamus, because that's your relay center, right? From the thalamus, where are the path? Where's this visual perception happening?
Occipital lobe.
Occipital lobe. You have your primary visual cortex. Yes. There's some offshoots here. If I'm in a bad mood, I'll tag this. But
It's
where
not.
does visual reflex happen? Superior colliculi. And then where does your circadian rhythm get set? Hypothalamus. Isn't that amazing? Okay. So here's your optic nerve, yes. Tunic in general. So I'll try to ask for the tunic. Fibrous? What would be the specific layer?
Sclera.
Sclera. Tunic?
Vascular.
What would be the specific layer? Choroid. Yeah. Specific layer here. The white part.
Cornea.
Cornea. Cornea. What's the function of the cornea?
Light entry.
Light entry and
Refraction.
refraction. Love it. What's the function of the lens?
Focus.
Focuses the image on the retina. Okay. So pretend you got shrunk down. You're now in the eyeball, bouncing around. You're looking forward. What would be right there that you're looking through?
Lens.
That's a lens.
Yeah.
Maybe only the people really close can see it. Bella, do you see little fibers right here? What are those little fibers here called? Anybody? Just immediately around the lens. That's holding the lens in place.
Oh, that's your
Suspensory ligaments. And then these little things that are these little rod-like structures, what are they? Ciliary processes. And what do the ciliary processes do? They produce the aqueous. You were right.
Get out of my way.
Okay, now let's look at some ear stuff. All right, so there's that. There's the ora serrata, that edge right there. Yes. Okay, that was the back of the eye. What was the instrument that we used to look at the back of the eye?
Ophthalmoscope.
Ophthalmoscope. I'm gonna ask you that.
Is that gonna be
No.
on?
Yes,
barely
let's do
spell it.
that.
Okay.
Come on.
Now, let's do the regions of the ear. Ready?
Outer,
Outer,
middle,
middle.
inner.
Awesome. Huh? What? Outer, middle, inner?
Yep.
Yeah? You didn't like that?
But
That's
we
not
like that.
awesome?
Keep it. Keep it.
Too easy for you?
No,
Okay,
no.
alright.
No.
Really hard.
Yeah.
Steve music.
What's the what's the top?
Pinna.
Helix?
Oh, lobule.
Lobule? And then what about that thing? I think they're trying to actually make it that guy right there. What's that called? Tragus. What's the most common admission for babies into the ER? Not an inner ear infection, a
Medius.
middle ear infection. Because it's
Otitis
called what?
medius.
Otitis media for the middle. Okay? So something's infected in there. Talk about that in a sec. What is the structure here called?
Cochlea.
Cochlea. So you guys agree this is all inner ear? Overall function of this? Do you hear me?
Vibration of
Yeah.
sound.
So for hearing, this is what? Static and dynamic linear acceleration, right? Okay. And then this is rotational acceleration, deceleration, right? Yeah?
Yeah.
So the regions are what? Cochlea versus the
Vestibule.
vestibule versus the,
Semicircular canals.
these are semicircular canals. There'd be ducts inside of them, okay? All right, let's go back to the cochlea. Top of the cochlea, what's that called? Helicotrema.
Trema.
Okay, helicotrema. And then what about the core?
Modiolus.
Modiolus. There's 3 passageways here, yes? We'll do that on the big blow-up model. The modiolus has these little gaps in it where you're going to have the spiral ganglia. And then what's this coming off the bottom? And then what would be really specific? The cochlear branch of CNA, yes? Okay. What's this passageway called here? Yeah, it's basically, the meatus is the opening, so that would be like your auditory canal versus the auditory tube. Yes? Okay. What lines the auditory canal?
Ceruminous glands.
Ceruminous gland, which is for what?
Sebum.
Earwax for what?
Antibacterial.
Antimicrobial, anti-bug activities. And how do we know this isn't a guy's ear? There's hair. Okay, I looked at some ears today. They're definitely guys. Okay. All right. First thing to vibrate.
Tympanic
Tympanic membrane. And then what are these three bones called? Boom, boom, boom. Malleus,
stapes.
incus, stapes, right? Collective name? Those are the ossicles. What's the function of the stapes?
To push the route.
Yeah, it's going to push up against which window?
Oval.
Oval window, and that creates waves in the perilymph, yes? However, when that pushes in, what do you want to push out to offset the pressure?
The round window.
Yeah, and guess what? It's round. Okay, so that's a round window. The handle of the malleus will articulate with the very tip of this membrane. What's the tip called? Umbo. Umbo. Malleus incus stapes. Okay. Now, you guys see the cochlear branch of CN8? What branch would that be? Yeah, remember it's the vestibulocochlear nerve, yeah? Okay, now, you guys see how this area here is a little bit swole? What's that little swollen area called? That's the ampulla. What would be the sensory receptor found within there?
Crista ampullaris.
Crista ampullaris, and that's for rotational acceleration, deceleration, yes? Okay, and then what would be the sensory receptor found within there?
Macula.
Macula, and that we said that's for head position as well as what? Linear acceleration, deceleration. Okay, let's go to here now. By the way, what kind of deafness would it be if these guys could not vibrate? Vibration.
Conduction.
Vibration is conduction. What would be the type of deafness if we destroyed a bunch of hair cells in there?
Sensorial.
Now I'm ready, Max. Sensory, neural, you betcha. Or damage to this nerve right here, yes? Okay. By the way, one common cranial nerve tumor is called a schwannoma. So what cells are involved with the schwannoma? Schwann cells. And it's oftentimes actually part of CN8. So these guys will complain about, oh, I'm dizzy all the time, or they have tinnitus. And so they do an MRI to actually check CN8 for that schwannoma. Okay.
Do people ever get like the vestibular nerves damaged at all? Like,
Sure. Yeah.
And then you wouldn't be able to tell movement?
Or you can have dizziness, you can have some, just vertigo, things like that. Okay. What was the function of this this passageway?
Pressure.
So it drains the middle ear, and then it'll help to equalize the pressure, right? Okay, so that you can hear. It's called the what again? Auditory tube or digitation tube. When you're a baby, that tube is flatter and shorter, so there's a greater risk for middle ear infections. Yes. Okay. Okay, let's switch over to. Let's go to that one. A bunch of these are the same, so I'll just try to point out some things that are different. So we saw lobule, we saw the helix, auditory canal, auditory tube. Yes.
Yeah.
Oh, we should have did this on the last one. Well, what's this guy right here? Tensor tympani, and that's the tensor tympani tube over here. Tensor tympani, it's a muscle, yes? Let's go back to this one. Give me the function of that.
Cracks.
So loud sounds, it'll what?
It'll dampen the world.
Yeah, it'll dampen the vibration to prevent damage to your hair cells, right? So what's the other muscle that acts along with it? It's the pedal muscle, right? Tensor tympani, it's the pedal muscles, They will dampen vibration with loud sounds to decrease hair cell damage. Okay. There's that auditory tube that we just did. Here's the inner ear, and then we see the ossicles. Yes. Cochlear branch, vestibular branch. What's that then? That's been cut on both of these. What travels with CN8 through the internal auditory meatus?
Facial.
That's facial, yeah. So it's just cut facial right there. 7. There's 7 again. Blood vessels we will learn in A&P2. Here's the other branch of 7, right? Going through the stylomastoforamen. Oh, this is good on here. What about this layer right there?
Ciliary.
Palpebral conjunctiva. Okay. Both sides. Goes all the way around. Cornea, yes.
Yes.
Sclera, okay. Right at that junction, there's a hole.
Canal.
Is there a hole in that one? Tiny, tiny, but there is one there. What's the function of that hole? Drains the aqueous humor. What's the function of the aqueous humor?
Provide nutrients.
Nutrients for like the cornea,
Also causes IOP.
lens. It also creates what?
IOP.
What's IOP stand for?
Intraocular pressure.
Intraocular pressure. Okay.
Too much of can cause glaucoma.
All right. What would be this specific space?
Like the cavity.
Anterior chamber. This space.
Posterior chamber.
Posterior chamber. What's this collective space? Posterior cavity. What's found in there?
Vitreous body.
Vitreous body. You guys remember the little vitreous body? That was cool, right? Okay. What was the function of the vitreous body?
Maintains the shape of the eyeball.
Yeah, shape of the eyeball. Also will help to hold the retina down because it does like push out. Okay. When you look at something straight down, what would it hit straight ahead? Fovea centralis. There's those extraocular muscles again. Optic disc, that's good. All right. Let's go to that one. Here's your superior middle nasal concha, right? What would be that guy again?
Olfactory nerve.
CN1. Then the nerve signals would go to here. Olfactory bulb, then the olfactory. Excellent. What bone is trying to be represented here? Or what bone feature?
Cribriform.
Cribriform plate, right? When you smell, it goes all the way up. And some smell molecules go all the way up there, right? Isn't that weird? Those smell molecules going up to your brain. Okay? Even the stinky ones.
No.
All right. What does the anterior 2/3 of the tongue for taste?
Sweet.
CN7. Posterior 1/3.
CN9.
Oh my gosh, this is coming from like the epiglottis. This is 10 right here. So you got your 7, got your 9, 10. Let's correlate it with here. 7, 9. That's the epiglottis right there. That thing that looks like a little cobra. Cobra Kai. So that would be CN10 for taste, yes? And then we did this. What were these guys? Structures. They're back here. Valate. For me, I remember it as making a V. Upside down V. Valate papilla. And then what about the mushroom tops?
Fungiform.
Fungiform papilla. Sides of your tongue. Foliate papilla. And then what about the little things that look like bristles? Filiform, right? Fili means thread-like. What's the one that does not have taste buds?
Filiform.
So what do they do? What do the filiform papilla do?
Gripping.
Grip your food, right? Okay. The other ones do have taste buds. Here's a taste bud right here. And what would be at the very top?
Hair.
Microvilli, or you can call them gustatory hairs, whatever you want to call them, either one. What are they for? Yeah, increased surface area, right? So you have just better contact. And then if this is a a random taste bud, it could be what? CN7, 9, or 10. Yeah. Good. Oh, hi. Collective name?
Oscillus.
Okay. Hammer time. All right. So, what articulates with this? Tympanic membrane, right? The umbo specifically. After the malleus would be the
Incus.
incus. After the incus, stapes. After the stapes. Look at the footplate of the stapes. What shape is that? Oh, oval. Yeah? And these are synovial joints. Let's say you do a test and someone has conduction deafness. You take the tuning fork to your maxillary process. What would last longer? Conduction or air?
Conduction.
If these can't vibrate, what will last longer would be conduction. Okay? But normally, when you have the vibration happening, you guys see the vibration? What would be better?
Air conduction.
Yep. All right. That. Okay, this model actually has a bunch of stuff on it. This is the back of the eyeball, and you see blood vessels. You guys see the blood vessels, the red and the blue there? Okay. So what tunic would this be? The tunic would be vascular. What would be the layer? Choroid, right? Creep up. There's this layer here that is right up against the photoreceptors. Usually it's dark. Pigmented epithelium. That will prevent light scatter, right? Absorb excess light. That also helps to support these cells. What are these cells? Those are photoreceptors, right? This is blown up photoreceptors here. Here's the pigment epithelium. The skinny cells are what? Rods. And then the chubbier ones?
Cones.
Cones. What are rods really good at checking?
Shades
Yeah,
of gray.
shades of gray, right? 50 shades. And do they demand, are they better at light, dim light, or bright light?
Dim.
Dim. Okay, when you're creeping around. Okay. Versus these cells,
Color cones.
cones, they're better with what?
Color.
Color and what kind of lighting conditions?
Right.
Bright light. Okay. Let's imagine that in dim light, one of these rods gets activated. What happens to the retinal? Goes from cis to trans. It detaches from here, okay? It'll activate what enzyme?
Glutamate.
Transretinal will activate phosphodiesterase, will convert cyclic GMP to regular GMP, and then the channels close. What happens to the rods then? Do they release glutamate or they don't release glutamate?
They release.
They don't, right? So when they don't release glutamate, we then go to the next cell, which is here. Is glutamate excitatory or inhibitory? Glutamate is inhibitory, okay? When you stop releasing glutamate from the rod, the bipolar cells then will excite. It'll depolarize. It'll then release neurotransmitter to the next cell. What would be the next cell? Ganglion cells. Those get excited, and so action potentials will go down CN what? 2. Isn't that cool, right? So when light hits the rods, the bipolar cells become excited because there's less glutamate. Okay, so just to recap on this, right? You got your choroid, pigment epithelium, nuclei of the photoreceptors, nuclei of the bipolar cells. There are some other cells in there that we're ignoring. And then nuclei of the ganglion cells. Yeah? All right. How about that eyeball with the cap on it? Lacrimal gland, right? Okay.
Gland.
Structure?
Upper eyelid.
Anybody? Superior palpebral. Remember the eyelid? Palpebral versus the
Inferior.
right. We did the whole puncta, lacrimal canals, lacrimal sac, nasolacrimal duct, caruncle. Yeah. Okay. Flip it over. We're going on the inside now. What would be lining the inside of your eyelid? This is a layer here. Palpebral, conjunctiva, right? Okay. So that's all that pink. And then there's these yellow glands. What are they called? Those are the tarsal glands. What's a tarsal glands for? Prevents the eyelids from sticking to your eyeball, right? Okay. There's that. Did all the sclera and stuff, right? Cornea, did all that. Tunic?
Well, it's dark.
Vascular, see the blood vessels? CN2, right? There's that blue eye again. Okay, alright. Iris, opening, pupil. Ooh, 64 is already tagged. Bonus. Structure? What?
Remember that.
Or serrata, right? Tunic?
Vascular.
You see blood vessels, but this is the nervous tunic. Remember, the nervous tunic has a double blood supply. Choroid on one side, and then these are the vessels exploding through CN2, yes?
Mm-hmm.
Okay. That would be the optic disc. Okay, this one actually has something in addition too. What are these structures here? These are your ciliary processes, and then right next to them would be your suspensory ligaments right there. You don't like that one?
No.
So recap some stuff. Okay, labyrinth,
Boney.
Boney, right? Oh, what's in the bony labyrinth there?
Spiral.
Ganglion, which are what? Cell bodies for CN8. Excellent. Let's do the ducts one more time.
Vestibular duct.
Vestibular duct, cochlear duct. Which ones have endolymph?
The
This
cochlear
is the
duct.
cochlear duct. Both of these have
Perilymph.
perilymph, right? What's the function of this guy? It can create fluid waves in what?
The perilymph.
The endolymph.
Mhm.
Okay. That. Whoops, perilymph. What's that?
What is that?
No, it's pens. It's okay. Penny lymph. Okay. Now, this structure here.
Tectorial.
What's the function of the tectorial membrane?
Bends.
Mass for bending the hair cells, right? Does it move or is it fixed? It's fixed.
Fixed.
Okay. Really, the thing that allows you to hear different frequencies is this, right? What's the structure here?
Basilar membrane.
It's the basilar membrane that vibrates at specific frequencies. So that little cochlear spiral, there's a part of it next to the oval window, that's for high frequency. Towards the helicotrema, that's more for low frequency. Isn't that cool? Piano in your head. Okay. So, basilar membrane, I like that a lot. Hint, hint, right? There is a structure that supports it. What's this little bony shelf coming out here? Osseous spiral lamina. Osseous spiral lamina. And then these sensory cells are hair cells, right? Yep, stereocily at the top. What's the collective name for this sensory receptor?
Organ of Corti.
Organ of Corti, or the spiral organ.
Corti.
Okay. Tanisha, can you name me that inner ear model, please? Bluetooth. No. No, it's the endolymphatic sac. We're not learning that one. Okay, labyrinth,
Boney.
Boney, and then everything in gray. Labyrinth,
Membranous.
membranous. So once again, we got your cochlea, vestibule, semicircular canals. Excellent. What's nice about this model is, it does show you the cochlear branch of CNA. It also shows you what? The vestibular branch of CNA. Also, what's pretty cool is that within the vestibule, there's 2 compartments. Yeah, so this one next to the cochlea is called the saccule, is next to the cochlea. No eye contact. And then what about this structure here? Utricle. What sensory receptor is found within both of those? That's the macula. Good. So if this is the bony labyrinth here, you guys, what's this pink fluid trying to represent? Represent. Perilymph? Yep. If that's the semicircular canal, this is the semicircular duct. Does that make sense? Now, follow the duct. Duct. Sorry. All right. This enlarged portion,
Ampule.
what's the sensory receptor within there?
Crista ampularis.
Okay, now let's play a game. Joey is spinning to the right. During this spin to the right, Joey has fast and slow movements of his eye. Which direction during the spin would you have fast and slow movements?
Right.
Right would be fast, slow, left. Okay. Ooh, it's really spinning now. Okay. Now, if you stop immediately, what's going to happen to Joey's eyes?
The opposite.
It's going to be the opposite, right? Fast left, slow right. Okay. What is that called, these fast movements? Fast eye movements are called nystagmus. Yeah. You guys remember doing that as a kid? Like,
Yeah.
I remember my front yard. I used to do that all the time. And you kind of look up and like, it was like so much fun. You do that now, you feel like throwing up, at least for me. Okay? I don't know what happens as you get older, you're just more sensitive. Okay? Now, what other things can trigger nystagmus?
Alcohol.
Alcohol, medication, infections, okay, MS, multiple sclerosis, otoliths falling out.
Falling out.
Okay, isn't that crazy? Okay. Enjoy these years while you're at your peak. It's only downhill after. No, I'm kidding.
40.
You guys still have a while. Okay. All right. Good. Any other models? How about your regions? What's this thing wiggling?
Tympanic membrane.
Tympanic membrane. Auditory tube. What's that right here?
Muscle.
It's supposed to be your tensor tympani. I don't know what the heck that is. Won't be tagging that. All right. Your ossicles, yes. How many semicircular canals are there?
3.
3. God's favorite number. And then what about the tip right here?
Helicotrema.
Yeah? What's the function of the pinna? Yeah, focus your sound waves. Top again was what? Bottom.
Lobule.
And then the part you push in?
Tragus.
Tragus. All right, rest of the time, open time.